Obesity and infertility, obesity and reproduction system. When we look at obesity, firstly, maybe what we should do is to classify the obesity according to the World Health Organization, which basically I'm going to simplify it very, very well. Firstly, underweight, which is below 18.5 kg per meter square. And the normal weight of a human being usually is said to be 8.5 to 24.9 kg per meter squared. And overweight, it will be anything above 25 kg per meter squared. Now, what obesity really can do to infertility, or how can it lead to infertility? Obesity leads to what is called ovulatory and menstrual cycle abnormalities. In other words, a person who's overweight usually have a problem with menstrual cycle, and that can lead to what we call amenorrhea, which is no cycle at all, or hyperandrogenism, in which there is high level of testosterone in their system because the skin, change estrogen to testosterone, and these people have a lot of testosterone in their system, which led to ovulatory problems. Ovulatory dysfunction as well, and ovulation that we can think about is a PCOS, which is polycystic ovarian syndrome. Now, the other important thing there is that obesity can lead to alter ovarian response and oocyte quality. With the oocyte quality, it means the eggs quality which are produced by a person who's obese tend to be of low quality. Now, the person who's also obese, we know that they have poor response to stimulation. Any stimulation you can talk about, that can be oral stimulation, that could be stimulation by injection and so forth. Then you need higher and higher dosage for this person so that she can respond to any medication of stimulation. However, although you have a lot of medication or high medication you have used, you still bound to have poor egg quality with this obesity. And the other third important thing, also obese people, they tend to have what is called endometrial function abnormalities. That can be low implantation rate, that can be high miscarriage rate as well. Now, let's talk about obesity in pregnancy. What is it that we can expect, and what is it that we should be looking after, especially if somebody had what is called obesity and she is pregnant? Pregnancy in obesity is associated by high gestational hypertension, by high gestational diabetes, by high cesarean section rate, by high stillbirth, and large gestational age babies, and also high congenital abnormalities. Therefore, even if you're pregnant with obesity, you still have all these problems which you may be actually having because of just being obese. Now, obesity is not only affecting females, it's also affecting male person as well. How does it do that? As obesity is associated with increase in what you call oligospermia, which is a very, very low sperm count. And also is in this people who got what you call increased asthenospermia, which is abnormality in movement or motility of the sperm. And also they've got an increased sperm DNA fragmentation or damages, and also with decreased sperm mitochondrial activity, which is low. Therefore, basically, in a male person, obesity can cause oligospermia, asthenospermia, increased sperm DNA fragmentation, decreased sperm mitochondrial activity, and also that lead to a major problem which we call blastocyst development is impaired. In other words, during fertilization of a sperm from a person who's obese, you may expect as well that the blastocyst development won't be okay.